Assalamu alaikum. This is Fakeha, and today we are going to discuss about Zika virus. So Zika virus disease was first identified in 1947 in rhesus monkeys in Uganda, and then it was subsequently identified in humans as well. First of all, we are going to discuss what Zika virus is and how it is transmitted. So basically, it is an RNA virus which also has reverse transcriptase. As a result of that, it uses its reverse transcriptase that is very similar to that of HIV. This virus can be found in blood, urine, semen, saliva, cerebrospinal fluid, breast milk, and amniotic fluid. Now, how this virus is transmitted? The virus is transmitted to people through the bite of an infected mosquito. Zika virus is mainly carried by a specific type of mosquito known as Aedes aegypti, and this mosquito is also responsible for transmitting dengue and yellow fever. Now, talking about the symptoms of Zika virus, let me make it very clear that when the infected mosquito bites, 80% of the people won't even get any symptoms. Only 20% of the people will actually get symptoms, and these symptoms include mild fever, muscle pain, joint pain, headache, skin rashes, conjunctivitis. And these symptoms are very mild, and these usually last for 2 to 7 days. But now comes the serious part. Do you know Zika virus also causes a much dreadful disease known as microcephaly? Microcephaly is a condition where the baby's head is much smaller than expected, as you all can see on your screen, which can later lead to complications such as dwarfism, seizures, delayed speech, and movements. So, if a normal individual is infected with Zika, it is not much of a problem. But if a pregnant lady is infected with Zika virus, her baby is likely to be born with microcephaly, and that could be quite dangerous, specifically if the infection occurs in the first trimester, because that's when the head is developing. Now, coming towards the diagnosis of this disease, there are two phases of disease diagnosis, an early phase and a late phase. The early phase includes roughly 5 or less than 5 days from the symptoms onset, and the late phase includes roughly more than 5 days from the symptoms onset. During the early phase of disease diagnosis, PCR is performed, and specifically transcriptase PCR is performed, and it detects viral RNA in blood or urine. During a late phase of disease diagnosis, serology becomes important as it determines antibodies against Zika in the blood. And ultrasound can also give information about Zika virus in the pregnant ladies, as fetal abnormalities such as microcephaly can be detected through it somehow. Now, what about the treatment and prevention of Zika virus? Well, there's no absolute cure or vaccination of Zika virus. The treatment is supportive, as in case of most of the viral infections. We just need to make sure that the patient doesn't get dehydrated, and pain relievers such as paracetamol are also given. And yes, one more thing, that if you're expecting a child and you get infected with Zika virus, you would have to get professional help in terms of gynecology. And this could involve ultrasonography and serial ultrasonography of the fetus to make sure it doesn't develop microcephaly. As far as the prevention is concerned, you need to keep your body covered as it is transmitted through mosquito bite. You have to use mosquito repellent. As we all know that prevention is better than cure. So this was all about Zika virus. I hope this helps with your understanding of Zika virus. Stay safe, my friends. This is me zooming out. Allah Hafiz.